So we're going to go ahead and administer your shot of testosterone, Bill. So what we need to do each time that we do this is we're going to take your vial of testosterone, and then you have 4 items that you need. You have a 1 cc syringe, you have a large needle to fill up to take the testosterone into the syringe. Then you're going to take this big needle off and replace it with this little needle to inject yourself so that it's not painful for you. And then we have an alcohol prep to keep everything sterile. And then finally, we have a jar to put the needles in, and then when this is filled, you'll dispose this because you can't throw the needles in the garbage. So let's begin by opening up the syringe, and the syringe comes in a sterile packet, so we just peel it apart. And it's a 1 cc syringe, so it goes up to 1 cc, and your beginning dose is 0.3. So we're going to pull the plunger down to 0.3. Okay? So we pull the plunger down to 0.3, and we're always going to inject as much air into the vial as we're going to pull back fluid in order to stabilize and equalize the pressure. Because if we just go and pull out and keep pulling out and pulling out, we're going to make a vacuum, and then you're not going to be able, it's going to leak. So we're going to take 0.3 out, so we're going to put 0.3 of air in. So we pull our plunger back so that the top of the black's right at 0.3, and then we're going to hook it to the big needle. So this is the big needle for drawing it up. And the reason we need a big needle for drawing it up is testosterone is thick. It's an oil solution. We can't pull it up with the little needle. We can inject it out with the little needle. We can't pull it up. And then it's very simple to screw these two together. Okay, so you go ahead and screw them together, and don't touch the tips because we want to keep it sterile. That's it. Okay, now that they're together, we take our alcohol prep, and we're going to use the alcohol prep to wipe off the top of the vial. So it's sterile, and now we're going to save this because we're going to use the same alcohol prep to wipe off your leg where you're going to give yourself the shot. All right, so we take our 0.3 of air, and we put the needle right into the middle of the vial in the rubber. So there it is in the middle. We inject the air in, then we pull up, and we'll notice that the needle tip is in the testosterone, and then we pull back a long ways, more than 0.3. All right, we flick the air out, and then we push up until we get to 0.3, and there we are, 0.3, no air. So this is your dose of testosterone ready to go.
Okay.
All right, now, we take off the big needle and throw it away. So it goes into the sharps drawer. And then we replace it with the little tiny needle for injection to you. So hook these two together. Perfect. All right, now,
Take this off.
yeah, when we're ready, we're going to take that off. Okay, so now all we have to do left is we're going to take the alcohol prep, we're going to wipe off your leg, and then we're going to inject your leg. So the best place to inject is the lateral thigh. So somewhere along here is good. We never want to go on the middle of the thigh because on the middle there are vessels, arteries, and veins and nerves we can hit, but on the outside there's just muscle. So we're going to just go into the thick part of the muscle. So what I want you to do is stand up, and we'll just loosen one side of your trousers here. Okay, so that's good. And what we'll do is okay, so this is the best part to give the injection. Anywhere in this area. We don't want to go over here. Just anywhere here. And if you're going to give your injections twice a week, one here and then the next one here, and just alternate back and forth. One here, just different sites. All right, so we take our alcohol, we rub off the skin in the area, clean off the bacteria, we let it dry, and then we take our syringe and we pull off the cap, and there's our little tiny needle, and you hold it like a dart, like this. You don't hold this here. So hold it like a dart, and then let's do this together right in the area that we cleaned off. We're going to go in together real fast. 1, 2, 3, go ahead. Boom.
Right there?
Right fast, yeah. Okay, now, Once you put it in, you pull back a little bit to make sure there's no blood. There's no blood there, okay? Now just push it in. Nice and steady. Okay, it's all the way in. Now pull the needle out fast. Boom, done. Okay, that's all there is to it.
Okay.
How'd it hurt?
Didn't hurt.
Don't even feel it.
No.
Okay, so you're done. You can sit down, and then we take this needle and we throw this into the sharps container, and everything else is trash. We throw this in the garbage. So we're all done with our shot of testosterone, and then when we come back, we're going to determine what your level is and whether or not we need to do this once or twice a week. But this is how we do the injections once or twice a week of testosterone. Any questions?
No.
Okay, thank you very much. What you're going to do is you're going to keep this,
Okay.
and when it's filled up, you bring it back to the clinic, and we'll dispose it through the appropriate channels because it's illegal to throw needles in the trash.
Okay.
So you just bring this back to us, and we'll do the appropriate hazardous waste. And then what you're going to go home with is you're going to go home with a packet of 30 syringes, 30 of the big needles to fill up, 30 of the little needles to inject yourself, and 30 of the alcohol prep. So that's enough for 30 injections. So if you're doing injections once a week, it'll last you 30 weeks, which is like 8 months. If you're doing injections twice a week, it'll last you 4 months. Okay, so you'll be going home with these, or we'll ship those to you. The vial of testosterone will come directly from the pharmacy to you, and that should include everything that you need.
Okay.
Okay? All right, very good.